The positions to apply the electrodes will be explained. This is the representative 10-20 placement. A total of 19 electrodes will cover both hemispheres of the cerebrum at equal intervals. The A1 and A2 electrodes are placed at the two earlobes. Odd numbers refer to the left side and even numbers refer to the right side. During electrode application, the inter-electrode distance is divided into 10%, 20%, and 20%, hence the name 10-20 system. If the subject is a patient with epilepsy, then shifting F7 and F8 electrodes backwards by 1 centimeter and downwards by 1 centimeter may facilitate recording abnormal waveforms from the anterior part of the temporal lobe. First, the method of electrode application will be explained. After deciding the location of the electrode, separate the hair at this point and press down the hair with 2 fingers to expose the scalp. Then cleanse the scalp with an abrasive to remove any oil and keratin. Apply the paste by pressing through the hair without overspreading the paste. Rub the paste on the surface of the electrode. Apply the electrode to the scalp and secure it with the surgical tape. From now on, the electrodes will be applied one by one. Put the subject in a sitting position. That will make electrode placement easier. There is no need to use a tape measure to decide the electrode positions. They can be judged by eye using 2 hands, and the electrodes can be set within a short time. The first electrode to decide is CZ. Since this electrode serves as the reference point for the left, right, front, and rear positions, this is the most important step. Use 2 hands to decide the midpoint of a line joining the 2 trachea. Mark this point by continuing to press with a finger. Decide the line that passes through this spot and joining the nasion and the inion. The midpoint of this line is the CZ position. During measurement, use the same hand and the same finger and take care to avoid errors due to the shape of the hand. After deciding CZ, form a line joining CZ with the tragus. The 1/5 point from the tragus is the T4 position. After deciding T4, the midpoint between T4 and CZ is C4. Repeat these procedures on the left side for T3 and C3. Next, the hanged lead line from CZ straight down to pass through the inion. Mark the 1/5 point from the inion as OZ, but do not attach any electrode. Join OZ to T3 and mark the 1/5 point from OZ as O1. Decide O2 position by the same procedure. After deciding the O points, the midpoint between CZ and OZ is PZ. Then the midpoint between O2 and T4 is T6. Repeat the same procedures on the left side to locate T5. During these procedures, use the lead line hanging from CZ as reference. This will ensure left-right symmetry. P4 is located at the point equidistant from C4 and O2. At this moment, if the distances from P4 to T6 and P4 to PZ are equal, then the electrodes have been placed properly. Locate P3 using the same procedure. Then all the electrodes for the posterior part have been attached. Next, the anterior electrodes will be applied. First, decide the Z electrode. The 1/5 point from the Nesian toward CZ is a Z position. FP1 and FP2 electrodes are applied as for the O electrodes. Using Z electrode and T3, T4 electrodes as reference, the 1/5 points from Z to the right and to the left are their respective positions. FZ is the midpoint between CZ and Z electrodes. F8 is the midpoint between FP2 and T4. Here we assume the patient to have temporal lobe epilepsy and shift the electrode 1 centimeter downwards and 1 centimeter backwards. Apply F7 by the same procedures. However, please remember the positions of F7 and F8 before the shift. F3 and F4 electrodes are applied in the same manner as P3 and P4 electrodes. In other words, F4 is the position equidistant from FP2 and C4. If the distances to the original F8 and FZ are equal, then the electrode has been placed properly. Apply F3 by the same methods. This completes the anterior electrodes. Finally, attach the ear lobe electrodes. With practice, the whole electrode attachment will take about 10 minutes. When all the electrodes have been attached, verify that the electrodes are placed at the correct positions by checking for left-right and front-back symmetries. Also measure the contact resistance. When the value exceeds 20 kiloohms or is unstable, repeat the attachment from skin abrasion. When the subject moves vigorously or when EEG is to be recorded for a long period of time, after confirming that the electrodes are in good conditions, use a surgical dressing to further secure the electrodes. But this procedure is not needed in ordinary examinations. Then cover the dressing with the net and secure with surgical tape. Finally, attach the electrodes for electrocardiogram, ECG, and electromyogram, EMG. Electrodes attached to the left shoulder, left neck, etc. can record ECG and EMG simultaneously. These are convenient positions. If we know which part of the body the epileptic seizure usually starts, then attaching electrodes to this part of the body will tell the start of a seizure. When recording during sleep, it is necessary to install electrodes to record EMG of the chin muscle and eye movements as well as respiratory monitor.